Hi, my name is Perez. This is my Health 425 3-minute video, and I'm going to talk about an experience that I had at work. I work at a dental office, so as you can imagine, we see a lot of patients every day. But several weeks ago, we had a patient who was somewhat deaf. I'm not sure exactly how much they could hear, but from what I understand, their hearing was about 25% of kind of baseline hearing. And so they could hear a little bit, but not super well. I had never taken care of this patient before, but several of my coworkers had, and they said that this was an awesome patient. You just have to speak a little bit louder to them and make eye contact. So I was pretty confident that I could take care of everything that they needed. And so I brought them back to the operatory. I got them all set up, and at our office, one of the things that's included in getting a patient ready for a procedure is offering them laughing gas or nitrous oxide. And so I did that. They accepted, and I turned it on pretty low. But just by virtue of the schedule that we had that day, this person had to be on laughing gas for about 45 minutes before they had their procedure done. So about an hour in total. And like I said, I kept the levels pretty low, so that wasn't anything that I was concerned about. And so after the procedure was done, it went very well. I let this person breathe oxygen for a second, and then I helped them stand up and I walked them to the front desk where the front office staff helped the payment get all sorted and kind of walk them out of the practice. So I returned to the back, I cleaned up the operatory, and about 10 minutes later, one of the front office staff came and got me and said, "Hey, Joey, this patient uh, seems kind of out of it." So we brought him back in, and they're in one of the ops we're not using right now, just breathing pure oxygen, which is kind of what you do when it seems like maybe someone has had too much laughing gas. Um, and so, as they were in that operatory breathing this pure oxygen, we were trying to ask them how they were feeling, if there was someone that we needed to call for them, if there was anything that we could do for them. And this person just wasn't answering us. It wasn't because they didn't want to, it was because they couldn't hear us. Fortunately, after it's about 20 minutes of breathing this pure oxygen and giving them breaks and just letting their head clear up, uh, they got up and they were totally fine and they walked out. Frankly, they were a little embarrassed, but it all ended very well. And so we were very happy about that. But just this experience made me reflect on the importance of having equal access to healthcare. Um, no one likes going to the dentist. Everyone hates it. And I think that would be exacerbated by having an experience at the dentist office where it doesn't seem like you're in control. Right? As much as this patient wanted to participate in helping their symptoms improve, they couldn't. Not because they didn't want to, but because we didn't have the tools to communicate with them. And I think that was a really eye-opening experience for me, just driving home the fact that there are people who, despite being citizens of the US and having lived here all their lives, they don't have the ability to communicate fully in their healthcare, which can make going to the doctor or another healthcare provider a very scary experience for them.